Hello, dear friends, and welcome back to Wellness Hub Seniors. Today, we will gently explore another important topic about sleep in older adults, common sleep disorders. As we age, our sleep naturally changes, but sometimes these changes can lead to more serious issues, leaving us feeling tired and unrested. If you often wake up at night, feel exhausted during the day, or your partner tells you that you snore loudly or stop breathing during sleep, these could be signs of a sleep disorder. We will learn about the most common disorders, their causes, and more importantly, gentle solutions to help you find the deep, peaceful sleep you truly deserve. Because healthy sleep is not just about comfort, it is also the foundation for your overall health and quality of life in your golden years. Let's begin our journey to explore sleep disorders in older adults. Part 1. Understanding common sleep disorders, their gentle causes. First, let us explore some of the most common sleep disorders older adults often experience and why they occur. 1. Insomnia. The silent sleep thief. Insomnia is one of the most common sleep disorders in older adults. It is not just about difficulty falling asleep, but also difficulty staying asleep or waking up too early and being unable to fall back asleep, leading to daytime fatigue. Causes of insomnia in older adults: natural biological changes. As we discussed earlier, the decrease in melatonin production and changes in the body's natural circadian rhythm can make it harder to fall and stay asleep. Health problems. Many chronic health conditions such as joint pain, arthritis, heart disease, diabetes, or prostate issues can cause discomfort and disrupt sleep. Psychological factors, anxiety, depression, stress, or even worrying about sleep itself, can keep your mind active when you are trying to rest. Lifestyle habits, irregular sleep schedules, excessive napping during the day, or too much caffeine and alcohol in the evening can also contribute to insomnia. To sleep apnea. The secret breathing. Sleep apnea is a more serious condition that many people don't realize they have. It occurs when your breathing repeatedly stops or becomes very shallow during sleep. This can lead to you waking up multiple times throughout the night, often unknowingly, to resume breathing. Causes of sleep apnea in older adults. Relaxation of throat muscles. As we age, the muscles in the throat and tongue can become more relaxed and collapse, obstructing the airway during sleep. Weight gain. Being overweight or obese can increase fatty tissue around the neck, contributing to airway obstruction. Anatomical structure. Individuals have naturally narrow airways or other structural factors. Alcohol and sedative use. Alcohol and certain medications can overly relax throat muscles, worsening sleep apnea. 3. Restless Legs Syndrome RLS. The irresistible urge. Restless Legs Syndrome is a neurological condition that causes uncomfortable or unpleasant sensations in the legs, accompanied by an irresistible urge to move them. These sensations often occur in the evening or at night, and can make it incredibly difficult to fall asleep or stay asleep. Causes of RLS in older adults. Iron deficiency. A lack of iron in the body, even without anemia, can be a common cause of RLS. Kidney disease. Kidney problems, especially end-stage kidney disease, can cause RLS. Certain medications. Some medications such as antidepressants, anti-nausea drugs, or antihistamines can worsen RLS symptoms. Genetic factors. RLS can have a genetic component, in some cases for REM sleep behavior disorder, RBD, acting out dreams. RBD is a more unusual disorder where people act out their dreams during sleep, instead of being temporarily paralyzed during REM sleep as is normal. Those with RBD may shout, kick, jump out of bed, or even injure themselves or their bed partner. Causes of RBD in older adults. RBD is often associated with neurodegenerative diseases such as Parkinson's disease or Lewy body dementia. It occurs due to a loss of function in brain mechanisms that normally prevent movement during REM sleep. 5. Periodic limb movement disorder, PLMD, repetitive movements. PLMD is a condition in which people experience repetitive involuntary limb movements during sleep. These movements are often jerking or flexing of the legs or arms, and can occur hundreds of times each night, disrupting sleep without fully waking the person. Causes of PLMD in older adults. PLMD often accompanies RLS, but can also occur independently. The exact cause is not well understood, but it may be related to dopamine imbalances in the brain. Part 2. Gentle solutions to reclaim sleep, what to do and what to avoid. Now that we have a better understanding of common sleep disorders, let us explore gentle and practical solutions to help you find peaceful sleep again. What to do, gentle habits to embrace. 1. Seek professional guidance. This is the most crucial step. If you suspect you have any sleep disorder, gently discuss it with your doctor. Your doctor can accurately diagnose and suggest the most appropriate treatment methods for insomnia. Your doctor might suggest cognitive behavioral therapy for insomnia, CBT. This is a very effective non-drug method that helps change thoughts and behaviors about sleep. Additionally, lifestyle changes such as weight loss or changing sleep positions can also be helpful. For sleep apnea, the most common treatment is using a CPAP, continuous positive airway pressure machine, a device that provides continuous airflow to keep the airway open during sleep. Some medications may also be prescribed to relieve symptoms for RLS and PLMD. Your doctor can check iron levels and suggest iron supplements if needed. This gentle consistency helps regulate your body's natural circadian rhythm, sending clearer signals for when it is time to sleep and wake. Engage in a gentle and relaxing activity for 30 to 60 minutes before bed, such as reading a book, listening to soft music, taking a warm bath, or practicing deep breathing exercises. Turn your bedroom into a dark, quiet, and cool sanctuary. Use blackout curtains, earplugs, or a white noise machine if needed to practice good sleep hygiene. These simple habits are the foundation for healthy sleep. Regardless of any disorder, you may have consistent sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. Try to exercise at least 30 minutes most days of the week. But avoid high-intensity exercise too close to bedtime. Always consult your doctor before taking iron supplements. Ideal bedroom environment. This can help calm your mind before sleep. Relaxing bedtime ritual, but often leads to fragmented and poor quality sleep later in the night. Limit or avoid alcohol several hours before bed. 3. Diet and nutrition supporting sleep for RLS. Ensure you have enough iron in your diet through foods like dark leafy greens, lean red meat, or legumes. Try to put away all electronic devices at least an hour before bed for all disorders. Limit heavy meals close to bedtime and prioritize light, easy-to-digest meals in the evening. Stay hydrated. Maintain good hydration throughout the day, but limit fluids 2 to 3 hours before bed to reduce nighttime bathroom trips. If you need to nap, keep it to 20 to 30 minutes and do it earlier in the day. Go to another room, do something quiet and relaxing under dim light, and only return to bed when you feel sleepy again. Some medications can have side effects or interact with other medications you are taking. Self-medicating can mask underlying issues and fail to address the root cause of sleep disorders. For gentle daytime movement, regular, moderate exercise during the day can significantly improve sleep quality. Activities like brisk walking, gentle yoga, tai chi, or swimming are excellent choices. 5. Manage stress and anxiety gently. These are key signs of potential sleep apnea, requiring medical attention. Stress and anxiety are major sleep disruptors. practiced gentle stress reduction techniques such as meditation, mindfulness, journaling, or spending time with loved ones. If you constantly feel drowsy during the day, even after what you think was enough sleep, if restless leg syndrome is severely impacting your sleep, be what to avoid gentle reminders for better sleep. Remember, seeking help is a sign of strength and self-care. 1. Avoid caffeine and alcohol, especially in the evening. Always discuss any sleep side effects of your medications with your doctor or pharmacist. Caffeine is a stimulant that can stay in your system for hours. Avoid caffeine after early afternoon. Alcohol might make you feel drowsy initially. To limit screen use before bed, the blue light emitted from phones, tablets, and computers can inhibit your body's melatonin production, making it harder to fall asleep. 3. Don't nap too much or too late. While a short, refreshing nap can be lovely, long or late, afternoon naps can steal from your nighttime sleep. Avoid trying too hard to sleep. The more you worry about sleeping, the harder it becomes. If you can't fall asleep after 20 minutes, gently get out of bed. 5. Don't self-medicate with sleep aids or sedatives. Always consult your doctor before using any sleep medications, even over-the-counter ones. Part 3. When to seek gentle guidance. While these tips can make a significant difference, there are times when it is wise to gently discuss your sleep concerns with a healthcare professional. Persistent insomnia. If you consistently struggle to sleep for weeks or months, despite trying lifestyle changes, loud snoring or gasping for breath, uncontrolled leg movements, excessive daytime sleepiness, concerns about medications, any new or worsening sleep problem. If you notice a significant change in your sleep patterns that causes distress, your doctor can help identify underlying medical conditions, adjust medications, or refer you to a sleep specialist who can offer more targeted solutions. Like cognitive behavioral therapy for insomnia (CBTI), a very effective non-drug treatment. Remember, seeking help is a sign of strength and Dear friends, as we gently conclude our conversation today, I hope you feel a little more understanding and a lot more hopeful about your sleep. Sleep changes are a natural part of our beautiful journey through life. It is not about achieving the perfect sleep of your youth, but about finding the most restorative and peaceful sleep possible for who you are now. By embracing consistent routines, creating a serene sleep environment, making thoughtful dietary choices, and gently managing stress, you are providing your body with the loving care it needs to rest deeply. But understanding these shifts empowers us to respond with love and wisdom. You deserve to wake up feeling refreshed, invigorated, and ready to embrace each new day in your golden years. May your nights be filled with peaceful slumber and your mornings with gentle light and renewed energy. Thank you for joining us today at Wellness Hub Seniors.